And now on the line is Breda Gahan. Breda has been a guest on this programme on Air FM many times over the last 9 years, and she recently retired from working with Concern Worldwide. Breda, welcome back to Air FM.
Hello, Darren, and hello to all your listeners. Thanks for showing interest and talking about World AIDS Day again coming up this Sunday, the 1st of December.
Okay, Breda, we are recording this interview on Thursday the 28th, and World AIDS Day, as you mentioned, this year is being marked this Sunday, the 1st of December, as usual. This is when our interview will be going out on the FM as well on Sunday. But we have a couple of big things to go through today. First of all, in only the last month or two, you have retired from Concern Worldwide. I read the article about you in the Irish Times a few months ago about you retiring. Can you tell me, Breda, how you feel about having retired from Concern?
Thanks, Darren, yes, and thanks to Circa Pollock for interviewing me for that Irish Times article. I am moving on from Concern, imagine after 35 years, but I'm continuing to work and support via consultancy, health and HIV work. I've been doing desk-based jobs until now the end of this year, and I'll see going forward what will happen next year. But as you know, I trained as a nurse and as a midwife, the Mater and the Coombe especially, and I worked in St. James's Hospital. And to be honest, the best work and the most engaged work I've ever been involved with has been overseas work. And I think I told you before that I'd worked in Iraq for 2 years in the mid-80s during the Iran-Iraq war. And out in the countryside, I saw girls limping, and I wasn't sure what it was. Then I learned it was polio. The girls didn't go to school, they'd never marry. And I also remembered at the time that actually this was preventable by an oral vaccine. So the incongruity of me working in a third-level referral hospital in Baghdad while a preventable disease was still spreading in Iraq did not escape me. And when I returned to St. James's Hospital, I was working for 2 more years on the oncology, hematology, HIV and AIDS unit. I volunteered to join Concern after 2 years then in 1988. Wanted to go to Somalia, but somehow I was posted in Sudan and ended up in Dinder district in the Blue Nile province. Sudan is going through a terrible time with internal civil war at the minute, and it breaks my heart to see how nobody is supporting effectively for peace. But it was a revelation for me at the time when I went to Sudan in 1988. I quickly learned Arabic, had to do my job supporting the Ministry of Health, working with vaccinators, frontline nurses, midwives, and the field work was especially special. I loved every day of my work in Sudan, and to be honest, it was my real university, even though later I got my master's in Liverpool University. Like I said, if I can reconnect, if she's still alive, Sit Noura, head of Sanar Midwifery School in the future, she deserves the Nobel Peace Prize. Like I said in the Irish Times article, midwives are the window to every community. They know what really goes on in households and community. And Sit Noura managed to persuade the village sheikhs to allow untrained, unqualified traditional birth attendants to go for training to support safer antenatal care and delivery. Many women died in childbirth in Sudan, sadly, and I saw or heard of a woman who died in childbirth every week. Nothing can prepare you for this. It was horrible to witness it. And the majority of maternal deaths everywhere, Darren, are very preventable. After the 89 coup, even then in Sudan, there were a lot of coups d'etats. I was able to work for a while. I was into my 3rd year. Then I had to go back to Ireland for special leave. More political upheaval, and the government of Sudan cancelled my visa. I was really annoyed, upset, as I wanted to rejoin the programme, especially working with Sit Noura, the midwives, the vaccinators, the frontline nurses and midwives. As I couldn't get back to Sudan, I was requested to go to Cambodia, and I spent some time up on the border working with the Khmer refugees. I went into Cambodia in 1991, first located in the capital city and then down in Kampong province. A very different context, conflict still ongoing, a much more difficult language to learn, Khmer, but it was, again, absolutely essential for my own protection and communication. And I still can't forget it, Darren, that one of the first deaths, despite the war going on, lots of landmine accidents, one of the first deaths I learned about soon after I arrived in Kampong was a woman who died in childbirth in a internally displaced persons camp in Krangampil. I'd spoken to her the day before, noticed she'd a transverse lie on palpation, being a midwife, encouraged her to go to the hospital when she went into labour. Sadly, she did not. There was fighting at night. The Khmer Rouge soldiers were still active in the area. And when I went to the camp the next morning, I found out that she was dead, had died in childbirth, and the little baby boy had survived. It was awakening again as to the terrible issue of pregnancy, mothers, midwives in countries where there is conflict. Ongoing today in places like Sudan, Ukraine, Palestine, Lebanon, Syria, and so many countries where conflict remains the big disruptor to all health, but especially affecting maternal and child health. The other thing about Cambodia was actually after St. James's Hospital, where I'd worked on the AIDS unit in the mid-1980s, when sadly everyone died, mostly young men, and we'd no treatment. The first place I saw HIV and AIDS overseas was in Cambodia in the early 1990s, before treatment was available there. Concern lost staff members to AIDS. Too many people were dying of this, what people in Cambodia called it the invisible landmine, like an invisible virus. And so Pal, a nurse working with us at the time, went on later to form CANA, a local Cambodian organization, now supported by Frontline AIDS, responding to people at the time with home-based care who were dying of AIDS in Cambodia in the early to mid-1990s. And to be honest, I was delighted, Darren, to meet some of the CANA members at the AIDS conference in Munich in July just past. And the theme of the conference there this year was Put People First. At the end of 1993, I was quite ill from dengue hemorrhagic fever, very debilitating. And I went to the Liverpool School of Tropical Medicine to do my master's. I did my thesis again on HIV with young people, focused on prevention, because I realized as AIDS was spreading in Cambodia in the mid-1990s, it was also exponentially spreading across East, Central and Southern Africa. I did my research in Tanzania on young people, and what I learned in Tanzania then, in terms of the complexities of HIV prevention with young people, is still relevant today, as relevant today as ever. I'd hoped to work in an English-speaking country after my master's, but Concern requested me to go to Mozambique, so it was another new language, Portuguese. At least it was ABC. I could read the Ministry of Health documents. And Concern at the time supported health system strengthening in all the program areas. I was based in Nampula, but I was supporting the health and HIV program in Manica, Niassa and Maputo provinces, working hand in hand with the Ministry of Health. I mean, the Ministry of Health is our key leader in all the countries we work, and I try to respect their in-country policy, strategy, practices, outreach programs, unless there's a big disagreement, and then we have a dialogue about it. HIV and AIDS medications were beginning to appear at the end of the 1990s, but were still not in Mozambique by the time I left. And after that, I was working on USAID-funded child survival programs, half my time based in the Concern New York office, but a lot of my time again, thankfully, on the fieldwork programs in Bangladesh, my first time working on urban health, and then in Rwanda post the genocide. We had great teams, great partners, strong ministries of health, and really it was a joy to be able to demonstrate positive results from baselines to end lines under the rigour of USAID, who had a very tight monitoring and evaluation systems of the programs. And to be honest, nothing can surpass my enjoyment and learning during the many years I had mostly in the field working with Concern and Ministry of Health team partners, Darren. I could write books on each of the 5 countries I spent a lot of time in, or 6 actually: Iraq, Sudan, Cambodia, Mozambique, Bangladesh and Rwanda. What I learned there is still with me, and I'm learning from my colleagues in those countries every day as we still keep in communication. Some of them are now my friends for life.
Okay, Breda, I don't know if you'd use this term, but I imagine that when the antiretroviral drugs came on, it was like divine intervention or some kind of equivalent term. Like when you were working with Concern, first of all, for years you didn't have the antiretroviral drugs, and then they came on board. So that change must have been absolutely, totally huge to you, was it?
Oh, quite remarkable, unbelievable, that suddenly a killer illness that had killed everybody who contracted HIV when I was working in St. James's Hospital, and then in especially Cambodia and Mozambique was dying, to find out that suddenly medication had become available that could not cure AIDS, but could halt the spread of the virus. And now we have this amazing slogan, you might have heard of it, U equals U. Undetectable equals untransmissible. And the message is simple. If a person today living with HIV regularly takes their medications, they reach an undetectable viral load, meaning they can't transfer the virus to other people. HIV is technically 100% preventable. And I think you know many people in Ireland today who talk about living positively with HIV. And many people, thankfully, in developing countries, the treatment came just in time. I was in countries like Liberia and Sierra Leone fighting with advocates locally, because initially, I think you might remember, people said that people living in Africa wouldn't be able to take the medication. They didn't have watches. They didn't know the time of day, which was ridiculous. People in low-income countries are well capable of medication when they know it can prevent them from dying of an illness that is fatal without medication. And I was particularly, I'll never forget my days, as I say, going into Sierra Leone and Liberia in the mid to late 1990s, early 2000s even, when the medication we knew was available in the USA, in Europe, parts of Latin America, but not in Africa or Asia. So, when the donors came on board through the Global Fund, PEPFAR, with Irish Aid support, EU, other donors, it was a lightning moment. It was a game changer. Absolutely, it was a game changer. And, people today living with HIV probably can't imagine, because they're too young, to remember what some of us saw in the mid to late 80s when treatment was not available. So many young people dying of a disease that we did not think we could ever stop. My worry now is during the COVID epidemic, some complacency has stepped in. Obviously, when COVID pandemic was being responded to globally, services stopped. HIV testing services in some locations, treatment services. Health workers didn't go to clinics for a year or two in 2021, 2022, 2020. People almost forgot that HIV was still being transmitted. Some people stopped taking their medication. And now, based on the latest World AIDS Day report, which just came out on Tuesday, in at least 28 countries today, the number of HIV infections is on the rise, including in Ireland.
Okay, Breda, we were that was a great answer there. Telling me, you told me some information there you hadn't told me before. So it's great hearing your story, working since 1980s in this area, HIV/AIDS. It's an amazing story. Um, you mentioned the UN report and UNAIDS Day is this Sunday. Breda, can you tell me a bit more about World AIDS Day this year? Like, what is the theme, for instance? And I understand we're talking about antiretroviral drugs there, but I understand that there's been a lot of progress since World AIDS Day last year, has there not?
Yes, the theme this year is Take the Rights path, focusing on human rights to be at the centre, where the stigma, discrimination, people are marginalised, gender equality is not supported. Excluded people don't go for services, which means they're probably not being treated and still transferring the virus to other people. Laws, policies and practices that punish and discriminate people are no help. And it was brought up at the AIDS conference in Munich a lot on areas of criminalisation that need to be addressed in terms of the rights of women. Look at the rights of women in Afghanistan now. The criminalisation of LGBTQI communities in certain parts of the world. The anti-rights movements increasing in some parts of Kenya and Uganda. They're not helpful in terms of halting and reducing the spread of HIV and AIDS. But the biggest news at the conference and this year, Darren, the biggest, probably most exciting news during the Munich AIDS conference, which I participated in, was the learning of a new drug called lenacapavir. Now, it did already exist as a treatment for HIV, but the new trial showed that lenacapavir, given as 2 or twice yearly injections, can 99% be effective in stopping the transmission of HIV. It's been approved by the FDA in the United States, and again, it can be life-changing for women who don't have to tell their male partners that they're taking a twice yearly injection to prevent HIV. I wish it wasn't an injection, but at the moment, this is what it is in terms of the new trial, and even it has been proven to be effective in pregnant women. It's the first clinical trial to test it for HIV prevention called Purpose 1. But again, the big barrier as last time in terms of access to medication is the price. Currently, lenacapavir, sold as a treatment for HIV by Gilead, the big pharmaceutical companies, but they're not the only one making these drugs, costs over $40,000 for a year.
For one person?
For one person.
God.
It's estimated that the generic cost of the drug could be down to $40 a year for every patient, 1,000 times less. And advocates, actors, The Guardian and other newspapers are arguing that lenacapavir now should come off patent and be produced as a generic drug if it's this effective. Otherwise we're allowing people to die needlessly. And The Guardian did a great article there a couple of weeks ago. I can send you on, Darren.
Okay.
The other, let's say, product that has been around a while, a microbicide, but again, not well promoted, again, particularly for women, because again, the latest UNAIDS report 2 days ago, even last year in 2023, almost 600 young women and girls aged between 15 and 24 acquire HIV every day. Almost 600 young women and girls between 15 and 24 years old acquire HIV every day. So we need to put preventive products in the hands of the people most at risk. The new product is called dapivirine vaginal ring. Again, it is a silicone vaginal ring inserted into the vagina, worn for 28 days before being replaced. And it releases an antiretroviral drug locally, which reduces significantly the risk of HIV infection through vaginal transmission. But again, the production, the fair pricing and the access like I said, to both lenacapavir and dapivirine are based on availability at low cost for purchase by, the Global Fund, Irish Aid, PEPFAR, UK Aid, USAID, to make it available at free to people most in need in the poorest countries. And unfortunately, the world funding for the response to HIV has been shrinking in the last couple of years and since COVID. Adequate resources aren't available. And more, let's say, advocacy needs to get back on track in, what's next year, 2025, so that we can reach the SDG 3 target of ending AIDS by 2030. HIV, like I said, remains technically 100% preventable.
Am I right in saying, like, Breda, like with the antiretroviral drugs that came out first, that lenacapavir and dapivirine will kind of inevitably become cheap or free, or will it take a lot more kind of advocacy and increased funding to those companies who produce them?
It will definitely require more advocacy, action, funding, persuasion, like happened in the early days of the first antiretroviral medications, to move these companies. I mean, they're making massive profits on so many other medications, that are not infectious diseases, from heart disease drugs to cancer drugs to drugs for asthma to drugs for epilepsy, all kinds of medications. They are not short on profits, Surely infectious disease medications that are, let's say, a winner for everybody need to be made cheap enough to interrupt transmission of a killer infection in 2024, end of 2024, early 2025. It's not viable. And that's why, we have the Access to Medicine campaign in Ireland. It's a global movement. Companies rarely move without a lot of persuasion. And it was notable at the Munich AIDS conference in July, as at previous conferences I've been. The biggest booths, lobbyists at all these conferences are the people with the most amount of money. It was the same at the climate conference we're hearing about recently. So it takes a lot of persuasion and advocacy and activism, and working with people living with HIV, people most affected, people on the ground who understand the issues. We can amplify their voices so that the drugs are made available. It's a human right that people have access to essential medication to protect life.
When you're talking there, Breda, about the AIDS conference this year and like previous ones, when you're talking the biggest lobbyists there were the people with the most funding, do you mean people working for the drug companies, like?
Well, yeah, and the companies themselves. I mean, they've got the biggest, pharmaceutical booths, displays at the conference to give away freebies, T-shirts, hats, whatever. They're needed as well. So it's a tightrope we're walking. But I mean, I talked to them all, and some of the drug companies there are from India and Thailand, and some of the generic producing companies in Asia. So they're much needed because we need the drugs, but we need them at affordable prices. And to convince them they can still make enough profit selling all the other drugs they make under their portfolio for, like I said, diabetes, heart disease, blood pressure, the increasing diseases of, even in many poorer countries now, we see an increase in what we call NDCs, NCDs, non-communicable diseases, like obesity, heart disease, diabetes, hypertension. As middle classes get more wealthy, people live longer, so there are more diseases that need more medication, just as in Ireland. So definitely more work needs to be done, like with concerned partners in the DOCUS network, COLOF, Access to Medicine campaign, HIV Ireland, ACT UP, Dublin, all the groups, who can talk at every platform, every opportunity, like I'm doing with you now, Darren, on every radio station, to get them to move their position. like a lot of these pharmaceutical companies have plants here in Ireland, or offices here in Ireland. So, we can keep talking to them. And as we were able to finally shift and get the first antiretroviral medications off patent protection, I think we can move together to get lenacapavir and dapivirine off patent to be produced at cost price.
Okay, yeah, hopefully, I agree with you, hopefully. Breda, you're not speaking to me today formally on behalf of Concern, as you've retired from them, so you may have more freedom in what you are saying now, but the election of Donald Trump, or re-election as Donald Trump as president of the US, his re-election may well not be a good thing for the global fight against AIDS. I don't know.
Yeah, I myself, and I have been reading of concerns, especially regarding funding going forward, say for USAID health and HIV responses. Like USAID was the main funder for the child survival programs I supported in Bangladesh and Rwanda, for PEPFAR, the President's Emergency Plan for AIDS Relief, the US contribution to the Global Fund, and funding to in-country and international US NGOs working globally. Concern and I have been a member of the US core group. It's called Collaborations and Resources since the year 2000. It's made up of 180 organizations and individuals working to support community health, HIV and child survival programming through partnership research and learning. We work together to talk to USAID, to support them, to challenge their government, just like we support Irish Aid here, to challenge the Irish government to continue to commit to the Sustainable Development Goals, including SDG 3, to halt the spread of HIV and AIDS globally. And even in the US already, I saw that the US Washington AIDS Institute issued a press release as soon as the election results were announced in the US, committing to hold a new administration under Trump accountable and urged the president to prioritize public health policies that can save lives, to respect human dignity, and to be led and grounded by scientific evidence, and continue the commitment to ending the HIV and AIDS, hepatitis, and sexually transmitted infection epidemics once and for all. It's still an issue in the USA. It's still an issue in Afghanistan, all the way A to Z of countries down to Zimbabwe. Another media platform, you might know them, Darren, Devex.
Yeah.
They're a big media platform for global development. And again, they wrote an article, John Plasto, who's the executive director of Frontline AIDS, challenging, and that we must continue to challenge our partners to step up to the plate to support for global health and HIV needs. Everybody now coming up to our election tomorrow is talking about the cost of living, house prices, the issues of homelessness, poor people, all that. But without health, there is no development. Health is wealth. At every family, household, community, village, country level. I have seen that in the worst days of AIDS. During 94, when I was doing my master's in Liverpool, doing my research in Tanzania, I had a young man and a young woman doing the interviews, obviously, in local language for HIV prevention strategies to help young people. But every day I was at AIDS funerals. It was so sad. Every day young people, that disease, nobody would say the word, Okimwi. The stigma and discrimination and the fear I saw. I was afraid myself, thinking, what is going on? This poor country, being ravaged, the best people taken out, young policemen, young teachers, young health workers, young doctors, young nurses. And if we allow HIV to continue, AIDS will increase and more people will die. Again, it's immoral to allow people to die from a technically 100% preventable infection. And we need to lobby, we need to speak and hold our Irish government, the next one, we need to hold them to account. And all governments we work with, again, like I say, even the ones that are difficult, from Afghanistan to Sudan currently, to Ukraine, to Zambia, Zimbabwe, Uganda, most people, I think, support what we are doing. Most people are humane. They want to support people to live happy, positive lives, illness-free.
Okay, Breda, I think I only have 3 more questions to ask you, and 2 of them won't take long to answer, I don't believe. But can you tell me, is the Father Michael Kelly lecture going ahead this year?
I checked, Darren, and it's postponed, I'm not sure why, but till early 2025. So I'll let you know when the new date is provided and where it's on, and
Okay.
what the theme will be post. I guess it'll be under the new government now, so we'll see who our new next Overseas Development Minister, who she or he is, and hopefully they'll be invited, and we'll see where Irish Aid is going in 2025 and what we can do in our small way in concern, in our DOCUS networks, COLOF, with your Near FM media support, what we can do to, as I say, try to deliver on the SDGs, and especially SDG related to health and HIV by 2030. We've only 4 years left. Am I right?
Yeah.
25, 26, 27, 28, 29. Yes, 5 years left until 2030.
Okay.
That's very short.
I think
that's one government. Elections every 5 years.
The first interviews I did about the SDGs were back in, I think it was 2013, before they came in. The years have flew since then. Okay.
Absolutely.
Breda, as I said to our listeners at the start of our interview, we are recording this interview today on Thursday the 28th of November, and the interview is going out on Near FM on Sunday, World AIDS Day itself. But tonight, Thursday, there is what sounds to me going to be a great documentary going out on RT1 television. Can you tell me more about this, Breda?
Yes, Darren. It's called Memorial, the story of HIV and AIDS in Ireland, explored through this new documentary. I was interviewed for it. I don't know what was included, if I was included or not, or what has been included, so I actually haven't seen it. But it was started, the interviews, post the unveiling of the Irish AIDS Memorial Monument just inside the Phoenix Park at the end of last year. So I'm certainly looking forward to seeing it, hearing it, tonight on RTE Television 1, Thursday, November 28th at 10:15 p.m. And as we, as for me, to keep myself motivated, I always say, for me, still HIV equals, as well as its human immunodeficiency virus. Sadly, the data going in the wrong direction, including in Ireland, including in Ukraine, including in many countries in North Africa, Asia and Latin America. HIV also, hope is vital. And like you mentioned earlier, Darren, the progress in the prevention and treatment since I worked in St. James's Hospital in the mid-1980s has been more than remarkable. Over 40 years ago, I can't believe it's over 40 years ago, when I first cared for people with AIDS who all sadly died then, it's stunning to see where we are now. And I hope we can make similar progress in the next 5 years up until 2030, with HIV being technically 100% preventable. And, spreading the U equal U message. Get tested early, get treatment early. If you take medication, you cannot pass the virus on to other people. And I don't think anybody wants to pass a potentially killer infectious disease to anybody else. So, like every World AIDS Day, it's on December 1st. But World AIDS Day is every day for people living with and affected by HIV. For what did I say, it was 520 570 young women and girls aged between 15 and 24 who will contract HIV today. It's World AIDS Day for them every day. So we need to continue and call to action everybody, hold leaders to account, and support all leaders here in Ireland and globally to take the theme of the World AIDS Day this year forward, the human rights path. Thanks a lot, Darren, to you. Much appreciated, and thanks to your listeners. And if anybody wants to contact me, you can put up my personal email address afterwards, Darren, breda.gahan@gmail.com. Anybody has any questions, any interest in any of the areas I've mentioned, please get back to me and I'll do my best to respond. Gura Mahagut.
Okay, I'll certainly watch the documentary tonight, Breda, and I imagine that it will be available to watch on the RT player at least for a couple of weeks, if not longer. Breda, the next World AIDS Day next year in 2025 will be the 10th time and 10th year in a row we both have covered World AIDS Day on Near FM, so I look forward to that, and we might be talking to one another on Near FM in the meantime. So I'll be talking to you soon, Breda, and I hope you have a happy retirement. I know you're doing some part-time work now, but I hope you don't work too hard, you know?
Thanks very much, Darren. Yes, maybe we can touch base after the Father Michael Kelly lecture in early 2025, and when we know our new government, and we see also what will happen with the new administration in the United States.